Coming up, we'll be on location at Clarity Brain and Body Clinic in Bethesda, Maryland, discussing the latest advances in neurological health and how they can effectively treat neurological conditions such as concussions, dizziness, brain fog, chronic pain, headaches, and more, with one of this area's top doctors and neurological health experts, Dr. Becca Timko. Welcome, Dr. Timko, to the Top Doctors Interviews program.
Thank you so much for having me. I'm so excited to be here.
Oh, it's our pleasure. We've got a lot to talk about today to educate the community, but before we do, I wanted to touch on your background, kind of talk about your practice as well. You're recognized as a top doctor and neurological health expert throughout the DMV region. You've recently opened this wonderful practice here in Bethesda, Maryland, Clarity Brain and Body Clinic. I wanted to begin by talking about your vision for the practice.
So our vision here is really to get to the bottom of neurological symptoms. Many patients struggle with feeling understood and heard in the traditional medical system and by traditional neurologists, and many of them are kind of left and they fall between the cracks. And so here we kind of offer what we like to call physical therapy for the brain, where patients who don't want or have not had success with medication and drugs and surgery, we offer them an alternative that is ultimately, I think, a little bit more effective in creating long-term symptom resolution rather than just masking the symptoms.
I love that vision for the practice, Dr. Timko. You're really quickly establishing a reputation for excellence in effectively treating conditions like dizziness, brain fog, concussions, and others, utilizing a unique and holistic approach. Can you tell us more about the approach and how it works?
Yeah, so we like to call it physical therapy for the brain, right? Because when you have a shoulder injury or something, you're often referred to physical therapy, but patients kind of slip through the cracks when they have things that aren't kind of those musculoskeletal aches and pains. And so what we do here is we really get to the bottom of what's causing those symptoms, and then we use our rehab techniques to help resolve them and create lasting success in that symptom resolution. So some unique things that we look at here that you might not have get tested somewhere else are things like eye movements, right? We use our eyes 100% of the day. So of course, if there's something going on in that system, it's going to be causing some problems. The other thing that we look at is the vestibular system. So that's your inner ear, and it kind of tells you where your brain and your head, your neck, where those things are in space. And that's often a very common cause of dizziness, is problems within that system. And like you mentioned, brain fog is often a big one too, because there's no magic pill or supplement for brain fog. And so it's often a combination of problems within the different neurological systems. And we look at all of those systems to figure out the best approach to get you feeling sharper, clearer, and more like your previous self.
And what would you say are some of the key patient benefits from your approach compared to other options?
A big difference with us is we do not use drugs or surgery. And so patients are really excited about that because they're tired of taking medications, especially when sometimes the side effects are worse than the medication itself, or they don't really notice a large difference with those medications. And so for us, that's a huge bonus, is because we get to really get to the root of the problem and use what we call neuroplasticity, which is the brain's ability to change and learn new things, to create new pathways and new ways of moving our eyes, using our balance system, et cetera, to get you feeling, your best 100% self.
I know we touched on some of the conditions, but what are some of the most common conditions that you do treat, or symptoms as well, that you treat here at your practice?
So a big one for us is concussion, but a lot of people think about concussion as in like sports concussion, right? I don't have a concussion unless I've got it playing football, but that's just not the case. Some other causes of concussion that we see very often are car accidents, slips and falls, and workplace injuries. So people don't really think about those, but even if you've had a concussion 5, 10, 20 years ago, you may still be suffering with some symptoms related to that, and so that's where we really excel. A few other things that we see a lot of are dizziness, some headaches and migraines, as well as brain fog, right? It's kind of a nondescript symptom that there's no easy fix for, but here we're able to pinpoint some really interesting different tests that you might have not seen before to find maybe the root cause of what's actually causing that fogginess or that slow cognition. Another one that I'd love to highlight is POTS and dysautonomia, which is POTS stands for postural orthostatic tachycardia syndrome. So a really common symptom that people might identify with POTS is is when they stand up, they get lightheaded. And so that is caused by the blood kind of pooling in their legs, and they may feel like they're almost going to faint, or they may actually faint. And so the treatments for that, again, are kind of not long-term solutions. A lot of people with POTS become bedbound or unable to leave their homes due to these symptoms. And so I'm really passionate about getting POTS patients the treatment that they deserve and getting them their lives back.
These neurological conditions can really affect our day-to-day life, our quality of life, just our relationships. So you're really changing lives, Dr. Timko. Now we know that patients are different. They all experience unique conditions related to their neurological issues that they're dealing with. What type of testing do you offer, Dr. Timko, that can help you kind of determine the best treatment option for each patient?
So we do some unique diagnostic testing here that you might not see somewhere else. So we look at eye movements in an eye goggle test. It's called a VNG or a VOG, video oculography. So we look at your eyes and how they're moving in complete darkness. They kind of look like VR headset goggles, if you've ever seen those. And they have infrared cameras in them that can see what your eyes are doing and how they're moving in the dark. And what we're looking for there is something called nystagmus, which is a beating movement of the eyes. And with that, that's very common in people who have dizziness disorders. And so that's one thing that we can kind of see that's going on in your eyes, kind of in the background all day, every day. And so that's one thing that we might identify in a dizziness patient. So that's a couple things that we're looking for in that eye movement test. The next test that we do as far as diagnostic testing is a balance test. And so for that, patients will stand on a balance platform, and it'll track how your weight is distributed as well as if you're wobbling or feeling unsteady. And we test that with eyes open, eyes closed, and then on a foam surface that makes it a little bit more challenging, as well as some different head positions to tell us if your balance is great, that's fantastic. We can then use it in treatment. And if it's not so great, and if you're feeling kind of dizzy, unstable, wobbly when you're walking around, we can identify that as well. And a great thing about that test, and most of our tests here, is that we get to compare your data, we get objective data, and we compare it to aged and gender matched controls. And so that gives us some data to show whether or not you're doing really great or if there's some systems that need some help. And so patients really love that we can get some objective data, because often patients are told that their blood labs are normal or their X-ray or CT, MRI are normal. And so there's things that we can find here that aren't normal that may explain their symptoms. So the last diagnostic test that we do is cognitive testing. And so that's really great because a lot of those brain fog patients, right, they feel slow or just not right or not themselves. And so we use that test to be able to quantify that, right? Is your memory difficult? Is it reaction time that you're struggling with? And so we can really pinpoint that, and again, compare it to aged matched controlled data and see which specific areas we need to work more on.
So it's really a science-based approach to pinpoint what the issue is so you can put the best treatment plan together.
Exactly. We love getting that objective data, and sometimes it's that aha moment for patients because they've seen 10, 20 other providers that have all told them, you're normal, there's nothing wrong. And that can be really disheartening. And so when we finally show them the video of their eye movements and say, hey, look, this is not normal. It is honestly sometimes life-changing for patients just to feel that validation that there is something wrong that can explain their symptoms. And then the even better part is that I know how to fix it.
What type of treatments do you offer for these types of neurological conditions?
So treatment plans will vary based on your needs and your findings. Everything is completely custom to you and what you need. But one thing that does set us apart as far as our treatment plans is the use of eye movement exercises. So we assess those with our eye movement test in the diagnostic testing. And then almost all patients will have at least one type of eye movement exercise. There are 5 to 6 different types of eye movements depending on how you want to categorize them. So a problem with any one of those types of eye movements can cause these neurological symptoms. And so that's something that almost every patient will have, and they do notice a very big difference once those eye movements are corrected, because if you think about it, from the time you wake up in the morning to the time you go to bed, your eyes are open and you're using your eyes. So if there's even something that's very slightly wrong, if you're using your eyes and jumping around and things like that thousands and millions of times a day, that adds up very quickly and can cause a lot of those symptoms.
Given that it's a science-based approach, what kind of results have your patients been seeing, and what's the success rate as well?
We have a lot of success with our patients, and they're generally very happy because, like I said earlier, we give them answers, right? We get to the root cause of what's going on. We don't just give them a Band-Aid solution. And so the most rewarding for me are the ones where patients get their lives back, the ones where they couldn't drive on the highway, or they couldn't take their kid to the mall to go shopping for a homecoming dress, or they couldn't go to the grocery store to shop for groceries for their family because those environments were triggering for their neurological symptoms. And so those are the things that I love getting results in my patients, is getting their lives back. And I think that's also where our approach really excels, is because it's driven by what the patient wants, right? If you have headaches and you don't really care about resolving those headaches, but your big thing is not being able to drive your car, then we're going to really focus on that and get you meeting your goals as soon as possible.
Dr. Timko, when do patients typically begin seeing results, and then how many treatment sessions are necessary to get the best results?
So patients can expect to see some sort of change day one, which is very exciting. The brain can change very quickly, and so that's very rewarding. Is they might not see long-lasting results, but they're going to see some sort of change day one, and that's the coolest thing. And so then after that, we try to shoot for about 12 treatment sessions before we redo those diagnostic tests that we do day one, to then get some more data and compare it to day one and say, are you doing better? And how can we do even better? So that's really cool. And obviously treatment results will vary based on if you've had your condition or your symptoms longer. It might take a little bit longer to resolve, but if I'm doing my job to the best of my ability, we should see some change day one.
And I really love the fact that you can literally see results from your first treatment session. To come in here with headaches or some of the issues they're dealing with and walk out of here seeing the results is really something that's got to be gratifying.
It is the best part of my job, and like one of my favorite patient stories is someone who had constant headaches for over 8 years and walked out of here day one with, before it was like an 8 out of 10 headache, and this was the first time her headache had been less than an 8 out of 10 in almost a decade, right? Those are the kinds of changes that we see here. And they take multiple sessions to actually stick, but just showing the patients that change is possible is life-changing. It's giving the patients hope that there is ability to change, because they've often lost hope in the traditional medical system.
Now, are these results permanent, or do we have to continue the treatments for the rest of our lives?
So I don't want to see my patients forever. That's what I tell them. I tell them that I want them out there living their lives and doing what they want to do. So absolutely, our results can be permanent. My door is always open to my patients. So if they hit their head again and get another concussion or something like that, symptoms can come back. But for the most part, I compare it to like trying to learn a new skill, right? Like riding a bike. It's really difficult at first, but once your brain knows how to do it, it becomes pretty easy and automatic and not something you forget very easily.
I'm so glad that we have you on, Dr. Timko, because this is something that is highly effective. It's a very unique approach, and most people aren't familiar with these treatment options or this type of testing. So it's great that we're doing this community outreach to bring awareness to these treatments and what you offer. I wanted to ask you, like, for example, if a patient contacts you, what's the process they can expect from you?
The patients will start out with a 15-minute discovery call with me, and that is free of charge to just kind of get to know each other, find out what your goals are and how I can best help you, and make sure that we're a great fit. And then you'll come in and do a free discovery visit with me. That'll be about an hour of free diagnostic testing. So that includes the eye goggle, eye movement test that we talked about earlier, as well as the balance test and the cognitive testing. So you can get some data in your hands day one and see if I have the answers to your problems. And then after that, we'll do our physical exam. So this is a traditional neurological exam where patients will be tested on things like cranial nerves, eye movements, can they feel the sensation in their arm? Do their arm muscles work properly? Things like that, ruling out red flags, and then also trying to pinpoint exactly what the cause of their symptoms is. So a pretty traditional but very comprehensive neurological exam. And after that, we'll kind of get our game plan after we've collected all the data, get your goals, and I'll create a custom treatment plan for you, and we'll get started as soon as possible.
Well, you're doing great work. You're helping so many patients dealing with these neurological conditions. You're changing lives, as we said. And on that note, I want to thank you so much for joining us, Dr. Timko, for being a guest on our program and educating the community.
Yeah, thank you so much. It's been such a pleasure.